Hello, good morning. I meet to Mr. Dean and also my fellow friends. So we are from Group 45 for PBI1082 English for Occupational Purposes. We will be representing the Alumnus Hospital Berhad. Consists of four members, which is me, myself, David Francis, Miss Lowell Graham-Mendel, Miss Fanny Saibin, and also Miss Gabriela Mary Narcissus, with our topic entitled Overcoming Language and also Cultural Barriers in Healthcare. So before that, I'm going to present the background for our study. Alright. So overcoming language and cultural barriers in healthcare requires interpretation services, utilizing translation technologies, and also training staff in cultural settings. So effective communications can ensure accurate diagnosis and also treatment, and also the patient satisfactions, which can enhancing overall care and also the quality of services we give to the patients. This is also can reduce the health disparities among diverse populations, especially the population here in Malaysia. So, by overcoming the language and also the cultural barrier in healthcare, it also can improve the health outcomes in multicultural settings, which also can improve the overall the healthcare system in Malaysia. So without further ado, let's invite Ms. Gabriela to present her topic. Ms. Welcome.
Thank you, Mr. Lionel. Good day, everyone. I'm Gabriela, the Secretary of Alumnus Hospital Berhad. So the main points of our presentation today is promoting cultural competence training for all healthcare professionals. In this presentation, we will explore the importance of cultural competence in healthcare and how implementing this training can significantly improve patient care. So, cultural competence is essential in today's diverse healthcare environment. It involves understanding and respecting different cultures, norms, and communication styles. This training helps healthcare professionals communicate more effectively with patients, foster empathy, and build rapport. Ultimately, it leads to the provisions of medical and nursing care plans that respect patients' cultural preferences. The hospital should introduce cultural competence training for all healthcare professionals. This training will equip our staff with the necessary skills and knowledge to interact respectfully and effectively with patients from diverse cultural backgrounds. Firstly, understanding different cultural norms and communication styles is very crucial. These aspects of training will cover various cultural beliefs, values, and practices. By recognizing these differences, healthcare professionals can avoid misunderstanding and provide more personalized care. Effective communication is the key to successful healthcare delivery. Cultural competence training will teach healthcare professionals how to adapt their communication styles to meet the needs of diverse patients. This includes being aware of nonverbal cues, language barriers, and appropriate form of address. Empathy and rapport are very important for patient trust and cooperation. Training will help healthcare professionals develop a deeper understanding of patient cultural background and foster empathy. Building rapport with patients leads to better health outcome and patient satisfaction. Lastly, providing medical and nursing care plans that respect patients' cultural preferences is very important. This training ensures that healthcare professionals can create care plans that align with patient cultural beliefs and practices, enhancing the effectiveness of the provided care. Implementing cultural competence training offers numerous benefits. It improves patient satisfaction, reduces health disparities, and enhances the overall quality of care. Furthermore, it creates more inclusive and supportive environment for both patients and staff. In conclusion, promoting cultural competence learning for a healthcare professional is not just a recommendation, but a necessity in our diverse society. By understanding and respecting cultural differences, we can improve communication, foster empathy, and provide better patient care. Let's take this important step forward to a more inclusive and effective healthcare system.
So, good day everyone. I am the Chief Head Nurse of the Olympic Hospital Berhad. Today I'm going to present the alternative point on how to overcome language and cultural barriers in healthcare. So, for our first alternative point is the hospital should provide bedside teaching material in a multiple language program. It is crucial to provide bedside teaching material in multiple languages to ensure that patients receive accurate and understandable information about their care. It is also to help the nurses to communicate effectively with patients from diverse linguistic backgrounds. These initiatives aims to bridge the communication gap, improve patient outcomes, and enhance the overall quality of care. So first, we are going to collaborate with the local university and language departments. Working with local university and their language departments allow the hospital to develop bedside teaching material in Malaysia that are culturally relevant and medically accurate. These collaborations can help to create teaching materials that are not only linguistically accurate but culturally sensitive. Hence, it can also help to leverage academic expertise in language and cultural studies. Next, we are planning to create a mobile apps and website in different languages where the patients and the nurses can find bedside teaching materials in different languages. So, by developing a mobile apps and website makes the bedside teaching materials easily accessible to both patients and nurses. By offering these resources in various forms such as video, audio, and written formats can cater to different learning preferences and needs. For instance, audio materials can be useful for patients who are visually impaired, while video materials might be more engaging for those who benefit from visual aids. Also, these multi-format approaches ensure that all patients can access and understand the information that are provided to them. Hence, we are going to regularly ask the patient and nurses for the feedback on the bedside teaching material. It is essential to seek for feedback regularly from both patients and nurses for the continuous improvement of the bedside teaching material. By listening to the users of these materials, the hospital can identify any gaps or area for enhancement. This iterative process ensures that the materials remain effective, relevant, and user-friendly. Moreover, incorporating suggestions from those directly involved in patient care can help to tailor the resources to better meet their needs and expectations. Thank you.
So, hello and good day everyone. My name is Lawal Vera Manuel. I am the senior staff nurse of Olympic Hospital Berhad. So, now I will present about the last solution for the language and cultural barriers, which is the feedback mechanism. So in this feedback mechanism, we are going to assess the effectiveness of the language and cultural services provided by the hospital. The first thing thing that we are going to do is to distribute the satisfaction survey to the patient during the last day of hospitalization. By distributing this survey, we will know on how to make things better about the language and cultural barriers from the patient's response of the survey. So, for the survey, we are going to collaborate with the patient service department to create the question for the survey and to make sure that the patient will understand about the question for the survey. Okay, so next, we are going to make sure that the satisfaction survey is anonymous. This is to convince the patient so that they can express their experience with language and cultural barriers during their hospitalization. In addition, we will provide a sealed envelope and boxes in each word to maintain the anonymous. The last point is for the feedback mechanism. Can help the hospital management by doing the feedback mechanism, we can help the hospital management to identify the problem. So we had already established the feedback review committee so that they can gather and discuss about the problem in language and cultural barriers, followed by proposing some action for the improvement. That is all from me. Thank you.
Okay, alright. So, as for my part, I'm going to summarize everything that have been proposed by my teams. So we already proposed 3 ways on how to overcome the language and also the cultural barriers, especially in the healthcare setting. So as proposed by Ms. Gabriela, she already proposed that the cultural competence training is very essential because it can improve the communications of our nurses or our healthcare providers towards the communication with our patient, which includes all the cultural belief and also the language, like the local language, which can improve the overall communications between the nurses and the patients. So the 2 others alternate ways that proposed by Ms. Penny and also Ms. Flowell Vera, which is the usage, which is the bedside teaching materials and also the feedback mechanism is also important for our team because it can help it can help the communication between the nurse and the patient, especially in the ward setting. So together, all these 3 things are very important because it can enhance patient cares given by us, the healthcare providers, by promoting a clearer communications and better understandings between healthcare providers and also patients. Plus, the communication between us, the healthcare providers, to the patient is also culturally, and also it can culturally because the patient is from very linguistic backgrounds such as based on their ethics and also their religions. So I think that's all. Now I'm going to present about the graph that we found. Okay, so this is the graph that we found about the population distributions of the Malaysian population of Malaysians and non-Malaysians in 2016. So as you all can see, the red color is the Bumi Putra, and the yellow color is the Chinese populations, The blue color is the Indians populations and the others is the black colors. So as we all can see that the population is in Malaysia's come from the different backgrounds. This is why the things that we propose, the three things that we propose is very important in our healthcare settings because it can improve the patient care that we can deliver to our patients. So without further ado, moving on to our reference. This is our reference and this is our hospital logo, and that's all from us. You can contact us in our website for anything. So that's all from us. Thank you for listening.